This road gets lonely since you've been.
Hello, I'm Dr. Heidi Horsley, Executive Director of the Open to Hope Foundation, and I'm here today with Dr. Valarie Molaison, Clinical Director and Licensed Psychologist at Supporting Kids, the Center for Grieving Children and Their Families in Delaware. Our topic is communicating with children after a suicide. Valarie, when a family member dies from suicide, should children be told the truth?
It's a really important question, Heidi. And I would say the first thing I'd like to say is every family needs to decide for themselves what's right. You can speak to as many experts as you want, and we're experts about a lot of things from having worked with a lot of families, but we're not an expert on your family. But generally speaking, what we find for most families, telling the truth is very beneficial.
Okay. And what are the risks and benefits of telling the child and not telling the child?
Well, I think the main reason people fear a child knowing is that the child may not understand, may be in a great deal of pain, may take it personally, may have an increased risk of suicide themselves. And the problem with not telling is that secrets thrive in the dark. And when things are not told, there's a certain amount of emotional energy that gets caught up in it, that children sense that there's something weird or wrong and that they don't know something quite right, and they feel distrustful. And what you really need in a child who's newly bereaved from any type of loss is the idea that they can trust the grown-ups in their lives.
So what words could an adult use to explain suicide to a child?
You know, there's so many ways to do it. It depends on the temperament of the child and the age of the child and their vocabulary and so forth. But I do like to think of certain components. One would be to this child, to say to the child, you may have noticed that Daddy's been missing a lot lately. He's been coming home late, and he's been a little more grouchy than we've been used to when a long time ago before he was acting strangely. Children almost always have noticed signs of the person's behavior changing. So say that out loud, because that validates their own gut instincts of what they were observing. The second is to say, we noticed too, and this is what we thought about it, and this is how we understood it. So yes, Daddy and I were talking about how to help him because he seemed to be super grouchy lately, and we were trying to understand that so that he would feel better and get back to himself. And then to say if there was any treatment that was attempted or not, or if there was any diagnosis or not, using age-appropriate language to describe that. And then also to be able to let the child know that it was a surprise to everyone that the person died from suicide, and that there was nothing that they could have done to prevent what happened, and there was nothing that any person did to cause it. The person who died from suicide caused the suicide. And also that despite the fact that this person was in a lot of pain and made a decision that's now going to aggrieve the rest of the family and change the life of the family, that this person, in spite of that, still loved them all and was just in so much pain, made a decision that ended up being more painful than they probably intended.
Well, I think this is really important information, and it's a difficult topic, and I want to thank you so much for all the work you're doing with bereaved children.
It's deeper,
absolutely, thank you.
Flesh and bone, stronger than time. It keeps me close to you. When I open up my mind, so I chase butterflies, I reach for falling stars, I look for any sign from where you are. I call your name out to the wind so I can hear your voice again. Death can't keep us apart, I know you by heart.
You're my heart.
People think I'm crazy 'cause I talk to you this way. Oh, but you amaze me. with the words I feel you say. You're the inspiration that keeps me strong. I know you're just beyond my touch, but